Hi everybody, welcome back to the Bloomsbury Health Podcast, part 2 of the Tony Brown episode. We've got some really great insight into different treatment plans they're doing in Wimbledon, and also some of the great stuff that he's gone through and all the different experiences he's had over the years. We've also got a Dr. Sunil Arora on this podcast just to give everybody a more well-rounded idea of how this type of treatment works in and out of the private sector. Hope everybody enjoys it, and there's some stuff to be able to get a hold of Tony at the end of the podcast. Cheers. So outside of the oxygen tanks, what other sort of stuff are you guys mainly doing at the clinic?
Yeah, so the oxygen, red light therapy, which I don't know if you've come across that.
No. Enlighten us.
Again, this comes in several formats. Some people have panels, which are literally like sort of if you think of a whiteboard, but with little lights in it. The one that we've got is like that. It looks like a Breville toaster, if you remember. You lie inside it, and it's got 28,000 little lamps in it, which will deliver blue, red, and near infrared waves to the body. The blue will act on the surface, on your skin, and deal with any sort of, if you've got psoriasis, things like that, it's beneficial. And the red and near infrared go through to the bones and the joints, which go towards easing pain. And also you get a bit of a lift. If you get seasonal affective disorder, then it will lift your mood a little bit as well. So it replicates what the sun does in that respect. And again, it boosts energy and helps healing.
Wow.
Yeah, so interesting. Like, because again, this isn't something, if you unfortunately do get poorly and you go through the NHS, you're not exposed to any of these additional options that could even just, from helping to ease pain to actually impacting like the condition directly. It's like, it's very underplayed.
And I think as well, mood balance goes unnoticed. Everyone sort of addresses that by thinking that meditation and stuff like that. People will tell you like do yoga, and so it's not for everybody. Some people need something more direct or something that's tangible that they can see instead of it being a gradual over time thing. The idea that you can get into one of these and it gives you that lift that the first day of summer gives you, that's quite rare. That's quite hard to get quite hard to emulate that. And
I think the thing about oxygen as well is that the Multiple Sclerosis Society endorses oxygen therapy as something that helps. And there are various centres around the country. Multiple Sclerosis Society will enable you to go and get treatment there either at a reduced cost or virtually next to nothing if you have MS, because they understand the beneficial impact on people with MS, just giving them oxygen.
That's so nice to hear that people are embracing that and allowing it to become a more publicly used system. I think
anything that breaks through that barrier is awesome. It's like some of the medication Beth takes, it's because sugar affects cancer. Some of the medication Beth takes is for diabetes. It's to lower that blood sugar level. All these sort of things contribute. And and what we've seen in terms of like supplement management, making sure people have that balance of like it within the body to try, because without that balance, that's where I believe that it teeters. You go from having that balance within your body. If that's out of whack, then how are these other medications meant to work? It's almost like clogging the stream. If you clog the stream, it doesn't flow.
Well, it's a very important point you've raised there about sugar. We have quite a few people, as I said, who come in with cancers. One chap came in, prostate cancer, and his wife had sprung him from the cancer ward on the hospital. She did this because she arrived around tea time and there was somebody pushing around a trolley with cakes on the cancer ward.
It's awful, isn't it?
She lost it and said, "You're coming home now." I really don't, beggars belief. I do not understand how somebody's taking cakes round on a cancer ward.
Yeah. We actually went to try and get in touch with a food specialist through the NHS, and we managed to get a 5-minute meeting whilst we were waiting. But
it took months for us to get.
And like just whilst we were waiting for our next appointment. And she said I'd lost weight, so I needed to like up my chocolate intake and sugar to gain weight. And me and Josh just like looked at each other and were like, okay, well, that's absolute bullshit.
I think the words I used, I sort of was, thanks for wasting our time. This has been a bucket of fucking bullshit.
And it's awful. It's awful that people are getting like advised to take that side of it, because it literally feeds cancer.
So everything that was in the vending machines at the hospital, is what she recommended. And it was one of those weird things where it was like, okay, I look at that meeting in hindsight and go, okay, that was our first true thing where we were like, okay, we don't trust you. Or like we're gonna look into that might be a bit heavy-handed, but we're gonna look at our own stuff now. We're gonna take on what we've looked at, because everything you just said is what we've been told is completely not true. And again, the poor lady, like, I think didn't really take us too seriously. And it is that, again, similar to your not the same, but similar to your experience, where people don't know you at a personal level. They haven't looked at your file. They don't have an understanding of you. So like, to just treat you like a moron and then try to get you out of their office was not okay. It's
a very important point. I say this out now. I've got nothing against the medical profession, because there's a lot of really good doctors and nurses and medics out there.
We agree 100%.
Some of what they've been taught, though, is just wrong. And some of them are quite, how can I put it? What they learned was a long time ago, and things have moved on since then, and they haven't kept up.
Yeah.
I mean, that's one of the things that's very clear. The point you raised there also, Josh, about them not knowing you is spot on. I got a call from the doctors a few weeks ago saying, "I'll run your bloods and you need to come in for the results." And I said, "Well, just tell me over the phone." He said, "No, you need to come in." I said, "Okay, I'll come in tomorrow." "No, you need to make an appointment." Okay. I make an appointment. The earliest I can get in is 12 days from there. Now, for some people, that would worry the hell out of them.
Yep.
If I told you, "You've got to come in for your results. I can't tell you over the phone. Got to make an appointment, but you can't come in for 12 days, which then sets off stress in people. And stress is a big contributor to all kinds of illnesses that people have nowadays anyway. So I thought, okay, I'll come in 12 days. Went in 12 days, and he said, your cholesterol's a bit high. So, so I said, "What do you suggest I do then?" And he said, "Well, look, if we don't put you on statins now, within the next 10 years, you have a greater chance of having a stroke or a heart attack. So I suggest that maybe we start you on statins." And I said, "Do you know that I have sickle cell trait?" And he said, "Have you?" I said, "Yes, if you look on the notes, you'll see that." "Oh, yes." So I said, "You'll also know then that there is not a straight read across in cholesterol results with sickle cell trait." So I said, "So maybe you don't need to put me on statins now, do you?" "Oh, no, well, maybe we'll monitor it. You come back in 6 months." "Thanks, doc." Now, again, I'll say this is not his fault. It's
a system error, isn't it? Yeah.
It's because of the time he's got to make a decision.
Yeah.
And also he's just not taught certain things, which, to join some dots together, and he's missed that.
Yeah.
But the thing is that when that happens on a very large scale, you can end up making a whole population sick. The whole thing needs to be looked at in a different way. It's no good giving people 10 minutes.
No, agreed.
I did some research last year with an allopathic doctor and using bioresonance. And we both assessed somebody and came out with a similar result, and then put together a program to help them. And what became clear then is it's not one or the other. You take the best of both and put them together, focusing just on the individual patient, not a one-size-fits-all, and then you're going to get the best outcome for that patient.
Very much agree.
That has to be the way forward. I'm not sure how that's going to come about, but I think that increasingly people are starting to realize that there isn't a one-size-fits-all. And, precision medicine is the way to go, because we're all so different. You give 3 people an aspirin with a headache. One, it might fix it. The other one, it make them feel sick. And the third one, it might not do anything. And I think that's the way that we probably need to go.
Yeah, figuring out that personal side of it as well. I think, well, in our experience, we've been met with like, oh, like, okay, like you guys want to do that, like almost like, oh, more work. And then like, and you see some of like the medical professions and stuff like that, and you see how changes happen, even the times that we've been, since the start of our experience 5 years ago to where we are now, the idea of taking on a new idea is still in the same place. It's met with this, I'm not the decision maker, it's not up to me. Even when asking for an opinion on something, it's like you say, it's very that what the institute thinks should be the advice. For example, like to have a consultation with Dr. Sunil in comparison to, say, someone who's a junior doctor or an NHS doctor or whatever, will be completely different because of the restraints that one has over the other. Dr. Sunil can speak more freely, has a better idea, maybe has more experience than a younger doctor, but what you get is what you're given when it comes to the NHS. You change doctors, you're met with this, oh, really? And oh, we want to try this other thing. Oh, well, it won't work, but you can try. Like, and you're like, oh, well,
I think it's important for patients to realize, though, like, we are lucky we've got the NHS, we are, but they can't offer all of the other options. Do you know what I mean? So you might have to look further afield for your condition, and that's what our end goal is, really. If there was
a collaborative approach, I think would be the first stop. I don't know if both you guys would agree, but if we got to a collaborative point where your first stop is the NHS, that is your national health system, that is something that is a structural like staple here in the UK, and that's something that people should be very proud of. If they can't do anything, they should be able to express the open idea of what they think could be done. And then if you bring an idea to them, it shouldn't be shunned. It should be looked at in a way of like openness of, oh, they've brought something new here that I could learn, instead of it being, oh, well, I can't say anything, but, good luck. Like, that's not advice. And like we talked in the Dr. Sunil podcast, there's been times in our spot where we've had to remind people, like, we don't want to be doctors. We're just bringing you something that we think looks tangible, and we think that we've done our own background information. We'd just like your opinion on it. And you don't get anything back. You get ignored. But that's not, again, I think as long as people in the medical industry understood that we're not coming here to take your job. No one wants your job, man. Like we just because you guys have dedicated your life to doing this, you've gone down the road of becoming a doctor. We want your smarts. We just want your open opinion. And I think that's where you'll start to get some really good, maybe just some stress off the NHS, where people are going to them and expecting a miracle, and that miracle doesn't happen. But if you could go to them and have a collaborative conversation where they could express their thoughts, their real thoughts on it, instead of it being whatever the main or whatever they've been told by their higher ups to say in this instance would be a huge step forward. You would
It open people's eyes to other options, whereas some people we've met say waiting for like radiotherapy or to collect chemo have no idea about some of these things. Like I remember one patient Josh met whilst I was getting some treatment done, and they said like, oh, after today we should get a big box of donuts and like go home and eat them, and then stuff like that. And it's like little things like that where it's like if the doctor could say like, okay, like just a heads up, this is, some people think you shouldn't do this, like, do you know what I mean? Just kind of get other aspects towards people.
That was an interesting interaction though. That was I asked them if they had done they had looked into any of the cannabis based oils and stuff, because Beth was in a trial where everyone had the same condition. So I would be in the waiting room, like sort of asking questions to everybody and seeing what everyone was doing and like writing them down, and then going home and doing my own research on it to see if there was any gravity to it, if there's any if there's anything to it. And there's this one dude, such a cheerful guy, and his wife, and I'd always have we'd always have the same appointment time. We'd become waiting room buddies. And I said to them that there'd been that we'd looked into this cannabis oil stuff, which Beth doesn't do with immunotherapy anymore. We've now found that out, that that's not a great combination. But at the time, we're doing this, and then we'd found out this information that it helps break the brain barrier and things like that. It transfers over. It has all this good stuff. And this guy goes, "You're crazy, mate. That's some hippie stuff." And I was like, "Oh, okay. Like that's cool. Just thought you guys might want to know." And then they were like, "Oh no, it's okay. We're doing our thing." And then we got onto the rewards thing, and then it was like, "Oh, what do you guys do as a reward for, after you get your scan done?" And he's like, "Oh, I get 6 big donuts that are covered in icing." And I was like, "Oh yeah, oh okay. You guys know anything about like the sugar stuff?" And they were like, "Oh no, we haven't looked into that. We think that's like hoodoo."
But I don't think you'd really look into it, because before you get in this situation, you think like doctors are little miracle workers, and you'll go there and you'll click their fingers, you're better. No one once has told us through like the start of our journey not to eat certain things, and I think that's quite a fundamental thing to do with your health, really. I think you can't just keep going the way you're going because not necessarily something wasn't right, but you need to make it so your body's in like peak condition to go through all of this. And I think that's just advice that's missing.
And I think as well, like there's on that sort of stuff, the powers that be will try their best to educate the masses, like Dr. Sunil and Tony was saying, that like they're trying to do this in a massive way. It's also one of those things that some people will like reject that, it's all about just trying to get the right information in front of people, I think. And then what they do with that information is up to them.
Sorry, I think we went off on a tangent.
Yeah.
I mean, there's a few things to dissect there. I think with regard to doctors and doing this, there's a huge amount of information there. There's a huge amount of pressure there in order to perform your job. And the possibility of knowing everything is just not there for any individual. Like this, it's just not going to happen. And I think what we're talking about a little bit here is just taking responsibility for your own health as well here. So, and deciding for yourself which is the way forward. To us all here, it's really quite obvious that if you eat sugar, you're putting something in your body that is going to make something grow in your body. It's just obvious. And there are other things that can do that as well. And there are other things that you can do that are an inhibitory. And I have to thank Josh and Beth on this part of it. They opened my eyes to those things. I mean, I was probably, what are you doing in order to know what you're doing? But my eyes were also open to those things, and even meeting Tony, I hope he realizes that I was actually open to the fact and listening to what you're doing, and and that it works. And a lot of the people that will find us, hopefully, have been through that NHS experience, and then they've come here and gone, actually, we want something else, or it's just not quite working for me, which again is fine. If the NHS doesn't work for you, that's okay. But it's just empowering people. Yes, you can do other things or look into other things that possibly could work. And it's a shame about the chap from the donuts, you know, that just really disappoints me. And, you know, you really tried in order to help him and educate him on, look, this is something actually really quite obvious. It's an easy step you can take to be. I also feel for him because it's a bit of relief on that day, isn't it? The scan's gone okay. And we're taught to do that, even from kids, that if you do something well, guess what? You get a chocolate. Guess what? And then you're getting really into this reward mechanism, and it's a huge cultural influence that's happening to us of what we eat and what we drink and how we're consuming things. And trying to break away from that is sometimes I question myself: am I doing the right thing? Am I going in the right direction? Am I a doolally? Am I? It's like, or am I doing the right thing? And I have to keep convincing. I have to keep pushing myself back here to say it's all right. It's all right. But all of those things are playing out, aren't they? I think, and you're made to believe that that's the right way to go.
It's how we're
all
brought.
Those people.
It's how we're brought.
Yeah, it's like we're brainwashed into those sorts of thinking, or we're made to think like that, and it's difficult to break out from that. It's really hard.
Yeah.
From a very, very young age, you know, and I'm hoping that, you know, we move towards a different NHS, which is the natural health system. And then we start with natural things, and then we move progressively across to more invasive things as and when necessary.
Yeah.
And, you know, if a doctor hasn't got time to ask about your sleep, hydration, exercise, diet, stress levels, and effect of the medications that you're currently on, then they need to make time for that. And maybe be taught that that's what you need to do to make some connection with somebody and have some view as to what their overall lifestyle is before they is the answer. Because it's difficult.
I mean, it is hard for, you know, when you try, and I've been on the side of trying to educate patients about what's going on. I probably see it more than most. I was sometimes described as the nurse doctor because I was a bit more nursey than I was doctory, maybe because I'd listened. But
that should be a good thing.
No, it was the nurses used to say that you're one of us, you're not one of them. Funnily enough, but
I've had a belief that you should be a nurse before you could be a doctor, because like that would be such a good way of actually getting some of that smugness out of some of them and some of that arrogance, is that make them do the other job before they're allowed to do the big job. I think so.
I mean, it may come across to you as smugness and arrogance. It's probably more you're trained to think in a certain way, and that will work most of the time with what you do. And that may come across to you as, oh, they're being arrogant because they're not listening to me and they're not doing. I mean, my wife's also a doctor. We're doing this. We're doing some exercises with our daughter in order to improve something. I've sat in front of the consultant as a consultant and said, look, this really works. This thing that she's doing, I can't explain it. I don't want to believe it. My brain won't believe it, but it works. And I've seen an improvement. And that consultant just dismissed what I said and my wife said, even though we're both doctors and they're a doctor. This is colleagues, okay? So that we were talking about it last night, actually. And so it does happen. You know, it's not some of this stuff is hard to believe from a scientific mindset. I mean, and the other thing I've also found is that I found myself going backwards. And by backwards, I mean, you mentioned meditation earlier and yoga and things like that. My parents used to train me about food, and they used to say, look, this if you eat this, it's going to warm your body. It's going to give you this. If you need to be cooled down, drink this and have this. And to be honest, I thought it was all nonsense growing up. But actually, now that I'm more, I realized a little while ago, and I said to my mom, you guys were actually right about that. You know, you were right. And I listened, but I didn't listen, if that makes sense. And I remember as a kid, and I really used to love cinnamon. You know, if you licked a stick of cinnamon and that taste you used to get. But you know what? I'd rather go and chew a chewing gum with cinnamon rather than lick the stick. And I was, how mad is that? That actually, I could have got the taste from the thing that it actually was, but I chose to do something else. And I think that's so stupid. I'm disappointed with myself in that instance. But it's just things like that. It's just, I don't know if that explains what I'm trying to say, but
an excellent point there, because where do a lot of medicines come from? They come from plants.
Yeah.
There's so molecular plant extract.
But then they have other stuff added to them, which is not so good for us, instead of just the plant essence. And the other point, you know, that you made about sort of doing other jobs before you get to a point where you can tell people, you know, you're at the top, you're making the decisions. In a previous life, I was a local authority housing director, and I started my path towards that through being homeless. And I was so angry at the way the system worked, I thought I'd make it my ambition to climb the greasy pole as fast as possible so that I can make decisions that will help homeless people. Having got there, then you find out what a quagmire the politics of it all is, and it drives you nuts, did in my case. But it was quite different from my perspective, making decisions, than from somebody who'd been to, I don't know, a top university and just come straight into a job like that and then starts telling people what homeless people need or how council estates should be run and so on. Sometimes there is the advantage of lived experience, be that in education, be that in health, be it in politics or whatever, that makes a big difference. And sometimes when people are just parachuted in and they start pontificating and telling people what to do when they haven't got a clue, that's sometimes why systems don't work. And
I think that's part of... Oh, sorry, you go ahead.
I just think that there's a case for getting people early and showing them how things work, and then letting them rise up through the ranks or whatever that way, having experienced things along the way, rather than just being parachuted in.
Yes. Yeah.
Well, yeah, like you talked about before about going to therapy and things like that. I've had my own experience with therapy, and in one of my sessions, because we had the crazy diagnosis with Beth, we had COVID. We had to essentially get different government officials to be able to get Beth to Germany and back to keep doing this, like different treatments and stuff with Saskia. And in the therapy, the therapist, the guy says to me, he goes, "Well, you should find people that are within the same like framework, you know, people that are dealing with the same problems." And I lost it. I was like, are you kidding? Like you're telling me that they say about 4% of people Beth's age get this thing. How am I meant to be able to find people in a pandemic? Like I thought it was the stupidest piece of advice, because one, the people that are in our situation aren't looking to be coddled, or like we're not looking to just be around other people, because you're essentially just talking to each other about stuff, like you said, that's a bummer. Like, oh, like how's your cancer treatment going? Oh, my cancer treatment's going great. Your cancer, like, you know, what crazy things the government done to you this week? Oh, they've done this. Like, you don't want to be standing around that. I would prefer to be around a more positive influence, someone that may have got past that point of achievement, or at least has, like you say, a background or experience. Not just to just put you around these same people. That I just thought was just the most stupidest piece of advice, because it was just, I
mean, for some people it might work. Like, I do understand that, but again, it's not for me. Like, I don't want to spend my free time chatting to people with a similar condition. Like, I want to spend my free time living like a normal life.
I think that's as well like a very important point, is that when you go through some of these systems, and I think, Tony, with the people coming to you, they would get, well, correct me if I'm wrong, but they would get relief in the fact that there's a different mindset or a different way of thinking, because again, that relief, like you were just saying, Sunil, as well, like you found yourself stressed out trying to think of these things on different planes, like, and you're a smart guy. Like, if you've been thrust into a circumstance that you can't control, and now you're stressed and you're trying to work it out, and people are telling you these things that are very negative, or essentially fueling those things with also negativity, to be able to go to someone like yourself, Tony, must be refreshing.
I think, again, it comes back down to listening.
Yeah.
For instance, we had a couple of ladies who've been to see us with cancer, and one of them said, I know where this came from. I should have left that bastard 5 years ago. Because she's aware that her cancer came from trauma, as it does in many instances.
Oh, wow.
But often people don't, when faced with cancer, they don't go into that. They don't talk to people about their background. They don't talk to them about the traumas that they may have gone through, or significant life-altering or changing circumstances, which are a shock to the system, which can then precipitate a variety of illnesses, cancer possibly being them. And so it's just giving them the space to talk about stuff, which if they go perhaps to an allopathic doctor and say, I think it might be something to do, oh, shut up, here's the answer to that, go away. And it's just listening and giving them that space to do so, which makes a difference.
Yeah,
Awesome.
I agree with that. Because I think especially like, being so young when this happened to me, you feel so unjustified. And you wonder what you've done wrong. And then like we've heard this from Dr. Biskup as well, Saskia, and I went, and that clinic in Germany, the Arcadia one, where they actually had, as part of like this treatment program, you speak to a psychologist and they break down like your potential, what's not cause as such, but like ignition to it. Like, I think that it's an overlooked aspect for sure. And it helps you find peace with it a bit more, I find.
Specific, like, again, you've never been large on the therapy stuff, but the guy at Arcadia did something that just worked. And again, it's as well finding that right person for you. There's no one human being, it's a collective, and it's a figuring it out. But I forget the technique he did with you, but it sounded amazing. And it was like one of those things that sort of opened you up to, it was like, of like taking away the thing it took away from you was self-blame. Like, you went through like a wee period there where you believed that you'd manifested this, when actually when you find out more information, it's genetics or it's lifestyle or whatever. But that blame was so heavy on you that I didn't think it was very fair. So when what that guy did, or whatever happened in that session that worked for you, or those sessions that you had at Arcadia, like of dealing with that mind process, it just took away so much stress from you. It was noticeable. It's quite amazing.
But I think it's just, people find their own route through all of this, and what you offer, Tony, I think is a great option for people who aren't satisfied with what they can get from the NHS and are very open to other routes. Because again, like we were saying before, it's very sided towards like pharmacare, where there are natural it's not solutions even, but there's so many aspects to consider, and I think people can get a lot out of that rather than just the one dimension.
Absolutely right. And certainly, one thing I want to make clear is that anybody who comes to see us with cancer, we say continue seeing your oncologist.
Yes.
Or you're not coming in the door, basically. You have to do that.
Yeah.
And we had a lady in a few weeks ago, and it was Friday, and she rang up and said, look, I'm due to start chemo on Monday. I've just been told on the Tuesday that I have cancer and that I have to start on the Monday. And she said, I hear oxygen therapy helps. Can I come in? Now, we were busy that weekend, but it's okay, come in on the Sunday. She came in on the Sunday. She had 90 minutes of oxygen therapy and then spent 3.5 hours crying, talking, and I think possibly going through a similar thing that you did, Beth. Why me? I don't live badly. I don't drink too much. I don't smoke. I don't eat the wrong things. Why has this happened to me? And it was just being there for 3.5 hours to let her just vent, because the shock that she was going through was just horrific. You could see it. She was going through every kind of emotion imaginable.
And that's not something that's catered for when you go to the doctor, really. No, I know that's quite like a bold statement, but again, it's not their job to make sure you're feeling okay. It's their job to tell you what the situation is, and we'll see you next week for this.
Absolutely.
I think that's a nice aspect to like provide to people.
Yeah, and again, it's just providing that space.
Yeah. Well, yeah, I have one question for you, like just before we wrap up, because this has been awesome, Tony. And actually, like, I'd love to get down there and check out your facility and even maybe get Beth into some of these chambers.
Yeah.
Which would be wicked. But one thing I struggled with, especially with starting the Bloomsbury group with Sunil and Beth and Georgia, was I was so frustrated with the system that I didn't feel like it was my position to help. It wasn't my job. You know what I mean? And I turned a corner in my thought process, especially coming out of COVID. And that was because of like the people that were approaching us. Hey, I like young people here in Brighton, we get it quite frequently where we'll get text messages and things like that. And that's what changed my mindset. I realized that, hey, like it's not just us that's going through this, and the information that we have is important. I was just wondering, where was your turning point where a system that had treated you poorly, to say the least, and like had created a situation for you that wasn't desirable, what was there a turning point for you that where you went, nah, I'm gonna help, or I'm gonna do this,
Like,
or
I can get through this?
Was it meeting your wife? Was it what was it?
It was, remember exactly what it was. It was going on a public speaking course. And we got there, and a lot of people had different businesses that they were promoting and didn't have a business. I said, don't know what to talk about. And all I had at that time was one bioresonance device. And so the person who was taking the course said, well, what is it you're interested in? Is it health? And I said, well, yeah, but holistic health, because this is how this has helped me. Good, talk about that. I said, well, how long for? Now, at the end of this course, you have to talk for 29 minutes without notes, which was scary as hell for most of us. And I thought, well, how do I do? What do I fill the time with? So just explain what happened. And then I had this dilemma. Do I tell people about my past history with mental health? Do I tell people that I've been in a mental hospital, sectioned? I haven't told anybody that stuff. What are people going to think? And the person taking the course said, if you can help one person, just one person, avoid taking the decision that you took that Christmas Eve, then your job is done. And I thought about that. And from that day on, I thought, okay, big boy pants on, tell people. And ultimately as well, she said, your message is in your mess, which I thought was lovely. And that's what stuck with me.
I saw that quote. Yeah. And again, there was we took inspiration from a woman in America, the same quote, but hers was make my mess my message. And it's, again, yeah, that's so nice. That's nice to hear, and it's nice to.
And I love that concept. Like, if you've helped one person, then you've done your job. I love that, because that's kind of where we're doing this, because we want to help people. And even like getting a call from, I got a call from someone this morning actually, who my friend had passed me on to, and I think even just chatting to them and lightening their load a bit, like we can all help each other, like as a society and in this area of things. And it's just a really positive. It's positive to be positive about it, I guess.
Yeah.
Yes. You know, I think it's great what you are doing. And, you know, Josh, just please keep doing it.
Yeah.
Thank you.
Thank you. Like, me and Beth, Sunil, Georgia, and again, like, we hope to have you back on here again. Like, we'll have you as a reoccurring guest. That'd be great.
Always welcome.
You know, like every time you add something new to your clinic, get you back on here. It'd be awesome.
Do you want to give us some details about your clinic quick, so you know listeners can look into you further, maybe pay you a couple of visits?
Sure. If you Google us, go to Total Body Health Wimbledon, and our website www.total-body-health.com.
Okay,
Amazing.
perfect.